Hello everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. This is Mohammed Abdulabbas Hasan, Head of Biology Department, the University, corresponding author for subchronic effect of non-steroidal anti-inflammatory drug in sprague-dawley rats, a toxic and histopathological study with another authors, Ruqayya عبد الحسن ملاغي, فاطمة كريم كاظم, and أطياف حسين عليوي. Introduction. Non-steroidal anti-inflammatory drugs such as aspirin, naproxen, and ibuprofen, and another. But the aspirin, it is a potential, more potent non-steroidal anti-inflammatory drug that is used for the treatment of many disorders and many inflammation like arthritis. So the major problem may associate with the dietary supplementation of aspirin. This problem may be gastric ulcer, in addition to other factors. I mean, gastric ulcer comes from addition factors such as increased gastric acid, also pepsin secretion, increase the amount of this enzyme, as well as prostaglandin E2 and tumor necrotic factor. All these also may cause gastric microcirculation or gastric mucosal damage. Our hypothesis and aim of study, our hypothesis based on the documented evidence, the idiosyncratic toxicity of aspirin appears to have an unclear risk to benefit ratio. Therefore, it is critical to identify and determine any possible adverse side effect of non-steroidal anti-inflammatory drugs, especially aspirin, that could potentially lead to toxicity, especially when taken for a long term. Main aim of this study to investigate the toxicological pathology of non-steroidal anti-inflammatory drugs, especially the more potent one, I mean aspirin, by using white rat as experimental model to have an idea about the toxicity of dietary intake of aspirin in different toxic level to help us to avoid any side effect in the human. Also to determine the changes in detoxifying enzymes, antioxidants, and peroxidation status in rats receiving aspirin. Also to open the way for further researchers in toxicological pathology of aspirin and any related non-steroidal anti-inflammatory drugs for the benefit of a human. Our outcomes or our result of our experiment or trial summarized by different histopathological lesions. These lesions varied from organ to another, but where appears and considerable in liver tissue and other organ like kidney, adrenal gland, pancreas, heart, stomach also. The most significant treatment-related histopathological toxicologic pathology changes were in the liver, because, as we know, the most important detoxification organ is liver tissue, and those changes were varied from fasciculation, degeneration, to interstitial edema, necrosis also. These figures showed the histopathological changes of organ like liver, degeneration, fasciculation, hepatocellular necrosis, also septal fibrosis at the end of trial, while in the kidney we can see the degeneration, glomerular degeneration, also fasciculation, also dilation of cortical tubules, some glomerular damaged by aspirin because the aspirin infiltrated by the pelvic in the glomeruli. Also, adrenal gland have many changes like degeneration of zona vasculata and reduce in size, while the pancreas area also have, as we said, fasciculation and degeneration. Heart muscle also intracellular edema with fasciculation of myocardial muscles, some necrosis in myocardial cells, while stomach, glandular region, fasciculation, and mucosal of glandular region damage also. General conclusion of our study: the toxicological pathology of aspirin or of this group, especially aspirin, laboratory white rat, showed number one, treatment related changes in the liver, mainly as varying degrees of fasciculation in the centrilobular region and septal fibrosis, necrosis also. Number two, toxicological pathology lesions in kidney as dilated cortical tubule, damage some glomeruli. Toxicological pathology changes in islet of Langerhans, also in pancreas, mainly as fasciculation degeneration. Also degeneration and fasciculation myocardial muscle cells. Also degeneration of adrenal gland with the with the with atrophy of adrenal gland in some areas. Also erosion, ulceration of glandular region of stomach. Thank you so much for your attention. Actually, I make it less than 10 minutes because the email what I received said between 5 to 10 minutes, not more. Thank you so much. Have a nice day for all.